evening, dear friends. Welcome to today's episode of BMC Global Live Al Hilal Health World, Nothing But Lifestyle. This is a talk show with the expert doctors of Al Hilal hospitals and medical centers. Adolescence is a time of major physical, emotional and hormonal changes. As a young girl transits to womanhood, she may face many gynecological issues which may be uncomfortable and distressing. To speak about the gynecological issues during adolescence, we have with us Dr. Aisha Anjuna from Al Hilal Hospital, Rifa branch. She is a specialist gynecologist with an experience of more than 10 years. So, doctor, welcome to the show.
Thank you. Thank you for having me here.
So, doctor, what are the common gynecological issues faced by girls in their adolescence?
Yeah, as you told, adolescence is a very important decade in a girl's life. From 10 to 19 years up to 21 years because of the hormonal, psychological and physical changes that is happening in her body. And nowadays, most concerning factors are very different, and the most common concern now comes like early puberty, because earlier it was like from 11 to 13 years girls used to attain menarche. Nowadays it has come even up to 9 and even 8 years girls are attaining menarche. But if at all the girls are attaining menarche before 8 years, it is considered to be abnormal. That is called precocious puberty. And another condition is the delayed puberty, in which the puberty menarche will be attained after 16 years, or even after 16 years the girl is not attaining a menstruation. It is called a delayed puberty. That, or it will be like after breast development, 3 years after breast development she is not attaining menarche. It is called a delayed puberty. That is one concern. And the second most common concern is the painful periods or dysmenorrhea, and of course irregular periods or heavy menstrual bleeding. And then other reasons are which they come to us are excessive hair growth, acne or weight gain, and mood swings like a premenstrual syndrome. Before periods they will get lot of irritability, mood swings like that, sleep disturbances. Another common conditions are like gastric issues. They will come with constipation or irritable bowel syndromes, like they want to pass stools just after intake of food, which can be related to stress also. And then of course the vaginal infections and the recurrent urinary tract infections, and lots of psychosocial problems related to their studies or social mingling, self-esteem, like that.
Doctor, what is considered as a normal menstrual cycle for teenagers?
Actually, teenagers doesn't have a normal menstrual cycle. To have an abnormal menstrual cycle itself is considered to be normal for a teenager, like not for teenagers as such, especially in the early adolescence. Once they attain menarche, up to 1 year, definitely 90% of them will get abnormal periods, irregularity, because of the immature hypothalamic pituitary ovarian axis, that is our brain to ovarian signaling will be immature. So most of them will be having irregular periods. Up to 1 year, 2 year, it's okay to have it like that. And to attain a normal cycles of 21 to 45 days cycle like an adult, it will take almost 8 years from the menarche. So, and the normal menstrual cycle is like 21 to 35 days interval, and it should be like within 7 days the flow should stop, and it should not be heavy. Like if they have to change pads every 2 hours with passage of clothes or with the pain, it is considered to be abnormal. And that's it. And painful periods are always abnormal.
So, doctor, these days most teenagers complain about, doctor, most of the teenagers complain about painful periods and heavy bleeding. What is your suggestion?
Painful periods and heavy menstrual bleeding are a very common condition with which adolescent comes to us in the OP. And we usually take the history regarding the cycle regularity, how much pads they are changing, whether it is clothes are there, or if there is any another issues like bleeding gums, or like there are conditions genetic conditions related to heavy menstrual bleeding, like especially in adolescents with the first menstruation, because of the issues in the clotting factors in the blood, like von Willebrand's, hemophilia, like that. So first we will diagnose first time in a child's life, maybe during that menstrual period. So we have to take the history regarding her family history or her personal history, like if she cuts or bleeds easily or bruises easily, and in family history of any blood transfusions in the family, anybody have such issues. And further we will evaluate what is there any abnormal conditions like related to the uterus also, and we will manage accordingly. And we have to obviously rule out anemia, that is her blood is low, and we have to give her supplements for iron for the blood. And mainly we will manage the painful periods with the painkillers only, like analgesics. And it's a myth or this thing, like parents are like, can we give analgesic painkillers? Is it okay? Will it cause the problems in her future fertility? It's actually a very wrong message. The girls should not be allowed to go through such pain from their younger age itself. There is no problem in giving any kind of analgesics during her painful periods. We have to support them and consider them. Don't just tell that it is you are a girl, you have to yeah, it is quite normal, you have to go through this, and you are a woman, you should go through all this. Never tell that to a young kid. So we have to be empathetic and consider and give them medicines for their proper well-being. And with the analgesic windows like paracetamol or mefenamic acid, there is no problem in giving 1 or 2 tablets or in 1 or 2 days in a month. Nothing is going to happen for her in her future fertility also. And regarding the heavy menstrual bleeding, if kids are getting periods like after 2 to 3 months, obviously it will be heavy and very painful. So we will try to regularize the periods with the hormone pills. And like I told before, giving hormone pills also will never affect the future fertility of the girl. We have to manage her cycles regularity. Sometimes we will have to go for oral contraceptive pills, which usually parents are very skeptical to give them. And another conditions are like we will assess their body mass index and ask them to do exercise, follow a healthy lifestyle, reduce the stress. Then another supplements like magnesium, iron, and omega-3 fatty acids, they have shown to reduce the painful periods, because these painful periods are mostly considered because of the inflammation in our body, because of unhealthy lifestyle also.
Now we know that teenagers go through many gynecological issues. So how do these gynecological issues affect their mental health and self-esteem?
Yeah, obviously those painful periods will be like a trauma for the girls every month. And it's shown that the stress and anxiety and depression like that are more in those girls who are having irregular periods and dysmenorrhea. Actually, it is told that 2 to 6 times depression is more in the girls who are having dysmenorrhea. And especially if the periods are irregular and they cannot expect the periods on a correct date, their functions with friends or family, whatever, it will be affected. Once a parent and kid came to the OP telling that there is a pool party and she wants to know when her periods will be. She don't want to miss that. So it's like that. It will affect them very much.
It will affect their day-to-day life. Okay. So doctor, now coming to PCOS. PCOS is very common now. So can you explain about PCOS and how common is it in young girls?
Yeah, PCOS is the most common hormonal issue nowadays we are seeing in the young kids. And it is there are different criteria actually, and it depends on that criteria. 8 to 16 percentage of the adolescents are affected by polycystic ovaries. That is 1 in 10 can be affected. And polycystic ovaries, actually it is a lifelong condition, and which is caused by hyperandrogenism, that is excess male hormones in the body, and irregular periods, and there will be polycystic ovaries in the ultrasound. That ultrasound ovarian feature, there will be multiple small follicles in the ultrasound. And nowadays it is very common because of the unhealthy lifestyle the kids are following, and they should understand that polycystic ovaries are nothing like irreversible, but we can reverse it with our healthy lifestyle. And you should understand the importance of polycystic ovaries because of its relation with insulin resistance, obesity, and in the future you are going to have fertility issues and hypertension, diabetes, obviously cardiovascular diseases, everything.
So, doctor, can you now suggest some lifestyle changes for their good gynecological health?
Yeah, lifestyle means what we eat and how we move and how we manage our emotional and mental status. So regarding the diet, it should be very balanced and it should be nutritious also. We should have fruits, vegetables, and whole grains, lean proteins, and iron-rich foods like spinach, dates, all those things, and obviously calcium-rich food. And because the calcium is very much needed for our bone strength, and it is that important time where our bone strength is starting and maintained in the first that adolescent period. And next is the physical activity. Physical activity is also very important, and it should be like every 30 to 45 minutes. Physical activity is also very important to maintain a normal hormonal balance in our body. It should be like 30 to 45 minutes daily in a week, or at least 5 days in a week. And it is very important for maintaining our hormonal balance and muscle and bone strength, and also for our cognitive scholastic performances. Sometimes when we tell the parents to ask the kids to do exercise, parents will be like, no doctor, she don't have time enough to study itself. But we should understand that by doing exercises, they can they can study more, and their memory will be more by doing that physical activities. And next is the maintenance of the correct sleep timing. Try to sleep by 10 o'clock and wake up, maintain 6 to 8 hours sleep daily, and reduce the stress and reduce the screen time, like that.
Now, finally, doctor, what would be your advice for the adolescents struggling with these gynecological issues?
First and foremost is the lifestyle changes itself. Maintaining a healthy lifestyle with balanced, nutritious food. Avoid refined processed food, junk foods, and do physical activities, and manage the stress and sleep timing. Try to manage the stress by doing the exercises and journaling or meditation, yoga, or mingling with the friends, going out with the friends, and not just maintaining the friendship through the social media or Instagram, like that. You should have a physical activity outside also, offline also. And another thing are personal hygiene and menstrual hygiene, which you should follow, so that you should not get urinary infections or vaginal infections frequently. And obviously, don't Google or just ask or discuss with your friends and, yeah, she is like that, she also have like this. So it is not like that. Everyone is different in or unique in their own physical or hormonal changes. So any problem you have, you should come to a gynecologist or a pediatric gynecologist. And we should give the kids an environment so that they can speak freely and stigma free regarding their periods and their personal or menstrual problems. Like we should not judge them, we should not demean them, or by any means like body shaming, or why you have this acne, why you have this hair growth. They will be like ashamed. They may not be they may not come forth to see the doctor or even share their problems, which can more cause hormonal issues and mental problems with them. And we should be with them so that they can, like friends, so that they can feel like we are also one among them, to share their emotional and psychological and physical problems.
Thank you, doctor. Thank you very much.
Thank you so much for having me.
So viewers, as doctor spoke now, give space for our teenagers to speak about their health issues and guide them appropriately. For more informative episodes, tune into BMC Global Live Al Hilal Health World every Tuesdays at 8 p.m. Till we meet again next time with a new topic and a new doctor, this is Jasila Mujib signing off. Good night.
Our skin is the mirror of our soul. Our skin is our largest sensory organ. Our skin needs a healthy microbiome balance. This is regulated by its pH value, which protects the skin from pathogens, cold and ultraviolet rays. Sebamed protects your skin.
Let your child shine with creativity, confidence, and a whole lot of fun.
iMac Cochin Kalabavan is back with Summer Class 2025, a perfect mix of learning and enjoyment.
From cinematic dance, classical dance, vocal music, instrumental music, to art and craft, drawing and painting, and martial arts, we have got something for every young talent.
That's not all. We have lined up fun activities like field trips, movie time, yoga, games, thrilling competitions, and much more to keep the excitement going.
Worried about transport? We've got it covered.
And for the grand finale, every child's performances will be live streamed on BMC Global Live.
And guess what? All this at an affordable fee so that every child gets a chance.
Admissions are open now, and here's the best part. First 50 admissions get the registration fee for free.
So hurry up, call the number shown on the screen now to give your child a summer full of joy, creativity, and new friendships.